for this. So my proposal is we increase our public health fee to the $96. So in turn, we will get reimbursed from Blue Cross Blue Shield at that higher amount of the $86. Again, we're always usually able to bill for this, so I don't see this hindering anybody receiving the car seat education. We provide car seat education for our staff, all child protection workers. If they're going to transport kids, they need to go through this car seat education class, so we internally can bill for that. And then foster families, they go through the car seat training. Again, we can bill for that service. And then sometimes we offer some community classes, and again, we would look to bill internally for that.
Would so move, Mr. Chair.
A motion by Commissioner Masson. Do I have a second?
I'll second that.
A second to Commissioner Amon. And questions and discussion, Commissioner Emdek?
No, I was going to second it. That's.
Okay, any other comments or? Just a quick question about how many do you do a year?
I just looked and it averages, it's kind of, I have the monthly figure. So with COVID, we had to not offer the class. So we had like 3 months where we weren't able to provide. But I want to say last month we had around 20,
Wow.
17, 15. It averages anywhere on a monthly basis.
Well, it's certainly a very important training type to do, as we all know, and we hear the different situations that take place, and it's very complicated sometimes with child seat.
Yes, yeah,
nowadays.
it can be.
Yes, okay. Any other questions? Otherwise, I'll call the question. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously. Thank you. And next?
Thank you. Yep. Next, I am here to present the Caris Health mental health contract. So as the local mental health authority, we have to contract with a short-term medical nursing and psychosocial service provided to persons with illness and emotional disturbances in some type of an acute licensed facility that's accredited by JACO. So we contract with locally Caris Health. This would be for our mental health hold orders. We contract with Caris Health for a per day average stay. The 2021 daily rates that Caris Health has come back to us are not going to increase or change. So for our new contract for 2021, we are looking at no changes, and that would stay the same. So the 2020 contract that we have in place is $1,245 per day, and that would be a Monday through Friday stay. And then it's $855 per day. That is Saturdays, Sundays, and holidays.
Okay. Any questions, comments from the board?
I'll move on that recommendation.
A motion by Commissioner Emdek,
Contract.
I'll second
and a second by Commissioner Nissen. Any further questions at all? Approximately how many hold orders do we have a year?
Oh, goodness, I would.
Okay.
Yeah, I can
Put you on
get that
spot,
for
I'm
you, but I
sorry.
don't have that off the top of my head.
Sure.
Corinne, our mental health supervisor, would be able to.
Yeah, I think.
I wanted to say, I just looked at our numbers again, and this would be monthly. I wanted to say we had one person, 5, 10.
Okay.
It's usually in the single digits, but sometimes.
Yeah, it used to be like 2, 3 over the years, kind of pretty well
Yeah.
consistent, but
Yep.
I understand they maybe have gone up a little bit during COVID, and the rates seem not totally unreasonable.
Yeah, yep, we
that-
had an increase last year, a pretty significant increase, so we were very thankful that this year we're going to keep them consistent.
Okay, no more questions or comments. I'll call the question. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. Well, thank you very much, Jenny. And next, we are going to have an update and some information about the SNAP program, the Supplemental Nutritional Assistance Program, and Supervisor Leah Young. And we also have some people on Zoom. And Joan Burning, hi there. I don't know if the audience
Hi.
can all see her. So this is a
Thank you for
something new.
allowing me to. Right, this is something new, and thank you for allowing me to come through Zoom today so I could be a part of this. With the impending snow and living in Buffalo, I thought this might be a little bit easier than driving through the snow today.
Yeah. Well, this is one of the few positive things with all the COVID virus stuff that we can do something like this. We've never done that before, and I think this will work fine. Wave if you need attention or just speak up so we can give you a chance to speak as well. Leah, please go ahead.
Good morning.
Good
And we have
morning.
Deb Grunwald joining us also on the Zoom, so.
Oh, yes, and Deb, you're going to be part of this too. Okay. Sorry to ignore you you. All right.
So I'm going to present the SNAP contract with the Career Force that we contract with every year. Candria County contracts with the Career Force Center in Wilmer to provide services to our food support clients. They are able to assist clients with counseling, job search, job placement, and other direct program services. They are also able to provide transportation, such as gas cards or bus passes, and in some instances, car repairs, oil changes, or license costs. And sometimes they are able to help with clothing, tools, and other items needed for the job. In the last 6 months during the COVID peacetime emergency time, we have seen a substantial increase in our SNAP clients. In March of 2020, our SNAP caseload was 1,878. And at the end of September of 2020, our caseload is now 2,074. So we've seen an increase of about 196 cases. And in the last year, we've seen about an increase of 250 cases, which was from 2019 of September to 2020 of September. Not all food support clients are referred to the services that are provided by Career Force, as there are exemptions for those with small children or disabilities and other reasons. The clients that we refer for this money is for adult people without dependents. So it's not the whole cash program and the other program referrals. It's just for our SNAP contract. So. I thought it would be good to read from the program approach that is in our plan that we have written with Workforce. It kind of sums up everything. A strength-based approach is used to identify a participant's employment strengths and barriers to employment. Challenges are addressed and resources are provided as soon as possible to help the participant overcome the challenges that may interfere in getting and maintaining gainful employment. If needed, the employment specialist refers the participant to appropriate community services. They monitor participation in SNAP activities and continually assess for additional barriers, but focus on the participant's strengths. Employment services also emphasize the participant's transferable employment and life skills that have served them well in other areas in their lives. And we really appreciate being able to work with Joan and Bev and the Career Force staff and being able to work closely with them. So with that, Joan, would you like to offer a couple of comments?
Yes, again, thank you for allowing me this opportunity to join you via Zoom. I just want to say thank you, Leah, for explaining so well the SNAP program. And as you said, you have over 2,000 individuals, but a lot of those, don't come to see us because of, they have either children, seniors, disabilities and such. But we're pleased to work with the individuals that can and are able to work. And that's why they call them able-bodied adults without children, our term of called ABODs. So whenever we can help them, and provide services for them, it's a good thing in that we can get them back into the labor force. And I know Bev's going to give a little more information on some successes and what we've done. So again, thank you for allowing us to provide these services to Candria County.
With that, Bev, if you'd like to share a comment or two.
And welcome Bev Donnelly, a Workforce Center Specialist.
Thank you, Leah. Thank you, Joan. Good morning. My name's Bev Donnelly, and today we are bringing the SNAP employment and training contract before you for your consideration. I would like to thank you for your partnership over the years and the trust you have in our agency as your employment services provider, not only for SNAP, but for the Minnesota Family Investment Program and diversionary work programs as well. Beginning with December of 2018, Minnesota made the decision to move from a mandatory SNAP employment and training program to an all-voluntary program. This change exempts all work registrants, including able-bodied adults without children, from mandatory participation in SNAP employment and training. With that change, the number of participants being referred up from the county has dropped noticeably. For the program year ending September 30th, 2020, we have served 34 voluntary participants, with 6 exiting to unsubsidized employment at an average wage of $14.92 per hour. We continue to work closely with Leah and her team to promote our services at CareerForce to potential SNAP recipients. Even if we don't see them initially at the time of their SNAP enrollment, we can still meet and work with them at any time in the future as a universal customer, offering them services of resume assistance, job readiness workshops, interview preparation, and career guidance. As the coronavirus took hold in March of 2020, CareerForce went from in-person meetings with clients to a virtual setting. Free online workshops and job clubs can be accessed by clients through our website, careerforcemn.com. Clients also have free access to Coursera, a digital online learning platform that hosts over 3,800 courses and learning modules from around the world, including the University of Minnesota. An individualized employment plan is developed with each client, and a resume is created for them to use as they search for work. Employment counselors follow up with their clients weekly by telephone and email rather than in person. We are so looking forward to the day when it is safe again to meet with them in person. A recent success story involves a SNAP student who has limited computer access. Through our virtual services, we've done 3 resumes, a cover letter, a mock interview, and have completed 3 job applications all through our virtual services. She has since been hired at one of the jobs we targeted and should be starting soon as a certified nursing assistant. Thank you again for allowing us to serve the SNAP recipients in Candy, Ojai County. It's a pleasure.
Any questions or comments of Bev? Anybody? No? Okay.
I have a question. So what's the cost to administer?
Mr. Almond, go ahead.
Thank you, Mr. Chairman. So could you explain what's the total cost with your staffing costs? What is the actual true cost of bringing that person into employment besides, the grant or the amount of money here?
I'm going to refer that question to Joan.
Thank you. That's a good question. Our SNAP program, as you can see, is a very small budget, and we don't have the return on investment for each individual, but if that is something you would like, we could get that for you. How we look at the SNAP program is that we serve individuals, and all of them who come through our door, and as Bev mentioned, some of them we may not see right away, but we are offering them all the services that are offered through CareerForce. And so that's, so we don't have that individual, but again, if that's something you would like, we could get that for you.
Well, as always, you try to verify everything, and I'm not by any means trying to minimize your program and what you're doing for the people. Mm-hmm. It's just an issue of trying to verify what the true costs mm-hmm. are, and maybe it needs to be expanded on, maybe it's underfunded, maybe there's a larger need. All those things come into play when you look at quantifying the success of your program. And that'd be great information to have. Thank you.
Thank you.
Okay, great. And good question. Thank you for asking that.
We've been contracting with you for these employment services, a variety of employment services you're providing in our community since the 1990s, I believe, and you've mm-hmm. done an excellent job, and I'd be interested to know how many clients you've served over all those years and able to get jobs again and be productive people and paying taxes and working in the community. And but thank you for all you've done. And Leah, I think you're going to go over the contracts now?
Sure. We've got 2 copies.
Can Can we take each one separately? Yeah, and just kind of tell us a little bit about each one again. Since they're kind of grouped together, we just don't want to do two
We
contracts.
just covered the SNAP contract, and the other thing I was going to review was the fraud. So if you
Okay.
wanted to go right into that, the fraud overview?
Yeah, let's finish this contract up first, the
Okay.
SNAP one first. The joint powers agreement one. Is that the first one you have there, correct?
Yeah, it's a SNAP contract.
I think he's just looking for another overview again, so then they can approve the contract.
Yeah,
Okay, I just kind of went over what I thought was the overview of it, so.
sure. No, I understand that, just so we know what we're voting on.
Give them the
though.
dollar amounts, Leah, if you can give them the dollar amounts
Oh,
of
okay.
what the budget looks like and stuff.
From 20, we were increased to 7,478 is the proposed. And the current from the last year was 7,439. And then the supportive services was 673 for the proposed, and the new year will be 709. So
Okay.
that's the dollar amounts.
Any questions or comments about the contract from anyone?
I just have
Commissioner Nissen?
you just said 709. It says a payment on this contract, I'm looking, a payment for supportive services shall not exceed 673. Is that going to change to 709, or am I completely on the wrong page?
Yeah.
I wonder if that's,
This one has to do with transportation, Mr. Chair.
Yes.
I see that number
and that- go ahead.
673, but
let's look through the contract here. Or maybe Joan could clarify that for us?
Right. The allocated amount, and we get the allocated amount from the Department of Human Services. And so they give us the amount of the 7,487 for program staffing and working with our clients. And then there's $673 that was in this grant round for our support service dollars.
Okay.
Okay, where'd that 709 come from, or just?
Yeah.
Okay, I can explain that too. Support service dollars, and as you know, Department of Human Services and how they allocate money and how they get it from the feds, they have different program years. So we get a very small, the difference between that, we have to spend it between June and September, and then we have the other ones from October. And Bev, maybe you can help me with this one. I don't have my form with me. But we get two small portions of support service dollars. And for this contract, it's 673, but for the entire year, it would have been the 700 that you have also listed.
Mr. Chair, there are different
Yeah,
fiscal
Commissioner
years.
Matson?
There are different, excuse me, there are different fiscal years between the appropriations, and to say that it's confusing is an understatement. It's very complicated in terms of the contracts, clearly, but we have federal fiscal, we have different fiscal, and then we have state fiscal. None of them coincide. And Candywide County runs on a calendar year, so we now have a triple whammy in a sense, which makes it very confusing, I understand that. And it's been confusing like that for 20 years. We've asked it to be changed, Mr. Berg, as you well know, but we don't coincide the different fiscal years. So I hope that helps clear up the confusion.
Very much so for me.
Well,
And
it's
yeah,
in
and
the
just to let you know
contract.
that the amount,
As I was looking at the amount in the contract.
Yeah, so what we're signing, or we're going to agree to, is this number in here then?
Correct.
Correct.
correct, and the amounts in the
Yes.
contract are the
Yeah.
amounts on our DHS award letter.
Right.
Okay,
Okay, thank you.
yep. Thank you, Leah. Any other questions?
I would move, Mr. Chair.
A motion by Commissioner Mattson to approve. Do I have a second?
I'll second that,
A
Mr.
second by Commissioner Amon. I'll call the question. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously. Okay. Proceed, please.
So I'll have you sign the contract when we're done.
Yes, please. Yes.
Okay, so the next thing I was going to cover was a fraud overview. So I'd just like to share some positive news regarding the fraud costs. According to a study by the Association of Certified Fraud Examiners, fraud costs organizations an estimated 5% of their annual revenues. The government sector is one of the most victimized by fraud. Fraud against government entitles entities across the globe is an expensive burden on taxpayers and businesses, resulting in the increased cost of government services, loss of public funds and resources, decreased confidence in public officials, and increased expenses associated with the investigation, prosecution, and incarceration of individuals who commit fraud. Fraud impacts us all. It is everyone's responsibility to report potential fraud for anyone that suspects fraud for the recipients of cash, childcare, food assistance, healthcare, and childcare providers. Call this, or there's a toll-free number if you care to know, it's 1-800-627-9977. Candida County Health and Human Services has a fraud prevention specialist position dedicated to detecting and investigating potential fraud. Candida County Health and Services contracts with the Department of Human Services and the Office of the Inspector General for our fraud contract. As part of that contract, which includes reimbursing the salary of our fraud prevention specialist, we are held to performance measures and benchmarks that must be met. Our contract runs on the federal fiscal year from October 1st to June 30th of each year. For the fiscal year ending September 30th of 2020, our benchmarks have exceeded those established by DHS and also the statewide average. The following statistics may be interesting to you. So in Candida County, we had 494 fraud referrals, investigations. An average number cases completed per month is about 37, and the state benchmark is 25 to 30, so we're a little bit above the average. And the average days to complete a case is 3 days by Candida County, and the average days required by DHS is 15 days or less. The cost to benefit ratio is $7.89, and the state average is $7. So we're above the cost, the benchmark. So the cost savings for Candida County in this last year was $732,952. The overpayments identified was.
Can you repeat that, please? How much was it?
The
Savings?
cost savings was $732,952. Overpayments identified was around $31,000. It's a prevention program too, so we're not always seeing overpayments, but we can proceed to see what we're saving. So that's where that 732, it possibly wasn't all overpayments. It was savings based on what the investigation resulted.
Okay.
The month of November is proclaimed Fraud Prevention Month, where work in this area is showcased to not only highlight the importance of this work, but also to remind people to report fraud abuse when they see it or suspect it. Our fraud prevention specialist is trained to use tools in the investigations that help reduce or prevent fraud for our programs. We are glad to be able to partner with DHS office to continue to provide fraud prevention work for our programs. Do you have any comments or?
Any questions, comments, Commissioner Emdek?
I think I heard the number is 700 and some thousand savings. Is the cost of the preventive specialist included in that? So
I believe so.
that's over and above the cost of that?
Yeah, the
person?
contract for the grant that we receive is $90,000 for that position, so.
Thank you.
Yeah, I just have
Commissioner
another
Nis-
question, and I can't remember what it was going to be now. Oh, yeah. How many times a year do you get fraud complaints?
Well,
Like,
I wouldn't be able to
between
say exactly how many that are convicted, but we have do about 15 cases No, about 37 cases a month is what we investigate.
And how many of those are get even with the ex-spouse type false complaints? That's what I was getting at.
I'm not sure, I'm not here with the mask.
In a lot of divorce cases,
Oh.
we have people that try to get even with the spouse. Does that,
Yeah, I don't have that information.
and do you run into that, though?
Yeah.
And what is the, when you find that it's a false claim or a false accusation, is there consequences to that person?
Well, we have the possible criminal process that we do depending on the dollar amounts, and we do work with our county attorney as far as prosecuting for fraud, so.
Thank you.
Commissioner Almond?
Mr. Chairman, thank you for your report. Fraud, just the word makes a person uneasy, but it's part of life and our fault, being human. Some people more than others. I appreciate the work in the report, especially the one person we have hired. I heard, this is a rumor, I want to clarify it, that in the past, Candioi County has had more than one person hired full-time. I think we had a half person working at one time with the fraud department. I don't know if that was before your time or
No.
not. Is that true, or did we just
No, we have just
subcontract out?
the one fraud investigator and then the support services that go
Okay.
along with that.
Okay. maybe it was-
Jenny, you can probably reply to that.
Yeah, no, internally, we do just have one dedicated staff. And again, like Leah mentioned, we are lucky enough to have a contract with DHS that supports that salary of that person. But one comment I wanted to make, I believe it was last year, the state had put out proposals to other counties to add on and have another staff within other surrounding counties, agencies for fraud. For the longest time, we had kind of been the only county in our area to have an actual person dedicated to fraud prevention and to have this grant. And now a lot of our surrounding counties have also received money through DHS and have applied for the grant. So one concern I would have locally is that as that continues and more counties apply for a grant with DHS to have a staff member dedicated to fraud prevention, that we would maybe see our allocations decrease. I know a part of this state, it's really beneficial to have counties have a dedicated person. Like Leah mentioned, I mean, we've seen huge cost savings, and that's what our main goal would be for this. But again, with now our surrounding counties being able to add this service as well, that would just be one thing I would look to you commissioners to continue to advocate at the state level so we can continue this work and have it funded through the state. But that's where you might have heard some questions, because some counties were doing it in a multi-county approach, that they shared a position to do this work in multiple counties. So that's maybe where you heard that. But for us locally, we've only had one dedicated staff person and then some office support staff that help.
I was also kind of wondering what you were thinking about, or what the rumor you heard. It's my understanding that we have one full-time person. We used to contract with the Sheriff's Department for a half-time investigator. And the question, are we still contracting that, or is that part of their budget and they just help us out as needed?
No, so with this grant, we have only had one dedicated person in human services do this. And then if we need to reach out, that would be over and above. But usually we're able to do that just internally.
But that service is still there. So to answer Commissioner Almond's question is that we have one full-time person, but we do have the sheriff's investigators
If we need to.
assisting.
Yep.
If we need to.
Exactly, just like we would refer to county attorney's office. Yep.
Exactly. And then they're involved in these as well.
Correct, yep, and even
Exactly.
sometimes if it's even above county attorney's office, we've involved the state and they come to a mediation process.
Okay.
Thank you.
Yep. Any other questions? Okay.
Just one other question. And then could you explain how you're working in conjunction with Triad? I know that the conference was the Sheriff's Department works with seniors due to all the electronic theft that's going on. That seems to be the new crime. the new wave that some of the senior people are being exposed to and being taken advantage of. Do you work in any way with them, or do you work in conjunction with them?
The elderly? Is
Yes.
it-
Yeah,
Yeah.
try it. Yeah.
We do have communication, and we can help them learn how to use so that they have the help that they need not to get into that position. The education maybe is what I'm trying to say.
Thank you.
Otherwise, I can add on to that. So usually those elderly abuse situations come through our vulnerable adult line. So we handle that through different staff in social services, but then they refer them on to our fraud investigator if there's anything above and beyond. But that's a state number that people would call if they're worried or concerned about that. And we have 2 dedicated staff to assist with vulnerable adult investigations and issues.
Thank you.
Apologize, I don't, the people wearing masks, I don't always.
It's hard to hear, I
Hear.
know. Thanks for putting up with us. Yes,
Yeah.
you're doing a good job.
Yeah.
Any further questions at this point?
Okay.
Li-
Deb Grunwald was going to talk about just an overview of the financial unit. Deb, did you want to?
Okay. Good morning, Deb.
Yes.
Deb is on
morning.
Zoom. Yes, go ahead.
Morning, Deb Grunwald. I'm the supervisor at Candia County Health and Human Services. You know, Leah and I are co-supervisors of a team of 28 staff. We have 22 eligibility workers who determine eligibility for the public assistance programs, and our 1 fraud investigator, which Leah talked about, and then 5 office support. So we have a total of 28 staff in the financial area that help process and work through the public assistance financial programs. The Minnesota Department of Human Services oversees the county administration of all of those financial programs, and they require counties maintain a high standard of accuracy and efficient program delivery. And so our staff strive to achieve those high standards, and despite all of the complicated and varied policies between the different financial assistance programs. Now, each spring, the teams from Candia County Health and Human Services have been able to present our annual reports, and as we are all aware, this spring was one that upended even the best laid plans for our annual report presentation. So I'm here today to give you an update on the financial programs for Candia County from where we were a year ago to where we are now as we move into our 8th month of the pandemic. And just to give a few numbers of comparisons, we have the Family Cash programs, MFIP program, which is the Minnesota Family Investment Program, and then the other Family Cash program is the Diversionary Work Program. And between September of 2019, we had 24 cases for the DWP program, and because of the pandemic, we have converted all those back into MFIP, which we started out in September of 2019 with 200 cases, and we're now up in September of 2020 to 322 cases. So it's jumped up over 100. We do have some adult cash programs, and they have stayed actually pretty steady. Those are probably more people that are elderly or disabled and have been affected less financially by not losing their jobs and things like that. So they have maintained pretty steady. As Leah mentioned under the SNAP, our cases from September of 2019 to September of 2020 jumped up to over 2,000 cases now. Our medical assistance cases and persons have also seen a big jump. Back in September of 2019, we were at 11,567 total MA people in Candia County getting subsidized medical assistance, and we're now up over 12,500. So once the peacetime health emergency was declared, the county office building was closed to the public to ensure safety for all of our consumers and our staff. And this made a huge increase in the number of phone calls that were coming in and out of our agency. And because we were unable to see consumers face-to-face, we experienced a very high volume of phone calls. So over the past several months, our phone volume has been about 1,000 calls a week. Our drop box outside that we have available for consumers has been used much more by the consumers by dropping off documents and applications. And we've increased the number of times that our office support staff check on that drop box so we can keep up with the massive number of documents and applications that are coming in. So during this time of peacetime emergency, many waivers for the financial programs were put in place by the federal and state governments just to protect some of the most vulnerable people. Many people who became sick and lost their jobs, and some businesses closed or reduced hours that affected the income of so many people. And as you know, it created an economic downturn for many, many people. The financial assistance programs were there for the safety net that some people needed to fall back on as they faced not only economic challenges, but also physical and mental health challenges. Some of those policy waivers that were put in place by the federal and state governments on or about March or April of 2020 were, we discontinued sending paperwork for annual reviews. There was no adverse or negative actions allowed for many of the programs and situations which would reduce or terminate program eligibility. They removed the requirement for face-to-face interviews for the cash programs. Food and medical programs have not required a face-to-face interview, so that was not in effect for those programs. And most recently, they've allowed a verbal attestation from clients for some program requirements and applications, so that was a big shift. We had to change some of our processes on how we did that so that we could make sure that the documentation of those verbal attestations were documented correctly. Those waivers shifted the policies quite drastically, and there were weekly, sometimes daily changes to those policies that DHS required counties to implement almost immediately. Our staff have done a really great job of being flexible and brainstorming new processes quickly to ensure that accurate and efficient program policy is followed. It's been quite a challenge, especially when some of our staff are also dealing with possible sickness, isolation, quarantine due to the health pandemic. There are some additional federal programs for food that were put into place to help consumers with their food budgets. One was called the Emergency SNAP Program, and that was a program that was put in place for people that were currently receiving SNAP benefits, and they were giving an additional food benefit during the health pandemic. There was an additional program called the Pandemic EBT, or the PEBT program, and this was a federal program that qualifying families with children that received free or reduced price meals in the prior school year or were on the SNAP program to get some additional food benefits to help with their budgets. As the health pandemic continues, our agency strives to meet the needs of the people of Candiac County while ensuring that we apply consistent and efficient service to those in need. And in conclusion, I just want to thank our community partners who have helped our consumers with gaps where our programs do not reach. Some of those community partners are the United Community Action Partnership, Candiac County Housing Redevelopment Authority, the Salvation Army, Candiac County Food Shelf, Hope for the City Food Distribution, Lincoln, Spicer, and many other faith-based organizations. And we thank all of those for helping fill the gaps for those people that are most vulnerable and are in need. So I just wanted to highlight some of those things over the last year that we've been doing and how we're adapting to some of these changes. And so if you have any questions about that, I'd be happy to answer.
Okay. Any questions or comments at all, commissioners? What I just want to emphasize a couple of things here. If I understood right, you said approximately 12,500 people are on MA, medical assistance?
That's correct.
Pardon me?
Yes.
How many people were on
Yes.
medical assistance?
As of September, it was 12,540.
Okay, so about a good 25% of the population of Candiac County. It really points out the healthcare issues that we still continue to have over the years for people in our community. And also, I just want to reemphasize what you were commenting about is that Candiac County Human Services, we state supervised and county administered programs. So we have very little control of who gets what because of the rules and regulations by the state and the federal government. Correct.
Correct, and they also hold us to very high standards and do quality control reviews on our work to make sure that we're processing and doing our eligibility correctly.
Yeah, correct, okay. Any other questions or comments? Other than a very good update, and thank you so much for all this. All right,
Thank you very much.
okay, thank you. Oh, did you
I think, did we
have some more?
have some action that we have to take on either of those reports, or?
Is there just one contract
No.
for us to sign? Two contracts.
It's a SNAP contract today.
Okay. Right. Thank you. Yeah, I kind of thought the same thing. Looked like two at first, separate ones. Okay. While we're doing this, can we just proceed? Director Lippert, can you give us some updates?
Good morning again. So the main update that I just wanted to bring to you guys, I'm sure you already are aware, but recently DHS has announced changes to the managed care procurement process. DHS gained approval to postpone its RFP for healthcare contracts that serves people with disabilities and older adults, along with the family and children's contracts throughout the state by 1 year. So what this means for us in Greater Minnesota is that the request for proposals will come out in 2022 for implementation in 2023. The Twin Cities and Metros counties procurement will be 1 year prior to ours, so they will procure 2021 for implementation in 2022. DHS states that switching the contracting timeline for the metro areas in Greater Minnesota allows the state and stakeholders, along with legislation, time to discuss outstanding questions related to procurements in Greater Minnesota. That includes county-based purchasing, and it also makes sense just with the volume of work. I'm sure I talked when we went through the RFP, what was it now, two years ago, a year and a half ago. It is very time intensive for our staff and for the state. And so with COVID, it gives us a little break. My request to you would be to help bring some legislation forward. I know MAXA and I believe AMC has some proposals for legislative language, but really to have skin in the game in terms of the procurement process, hoping that counties have a voice that can be heard in that, and then also that some legislation can get passed on county-based purchasing.
Any questions? Other than that's pushing Prime West way back further.
That's right. That's not good news, but
Yeah, not good news.
Yeah. And then I'll give a COVID update at regular board. I know that's a hot topic, so we'll wait for that regular board slot.
Well,
Other than that, that's all I have.
okay. Well, and that completes our agenda. I hereby adjourn the Kansas County Health and Human Services Committee.